The way you counter misinformation and disinformation is that to do whatever you can, as often as you can, to provide correct information.
Chief Medical Advisor of the White House, go-to voice on COVID, public health leader for decades, a key figure in the fight against AIDS and Ebola, and a man who in the last few years went from being a celebrated icon and hero to someone such a target for hate, he worries violence stalks him. Even as he sets out to retire. So we talked.
Hi, Adrienne. Nice to be with you.
About what this moment and these fears are really like.
It's changed my life. I personally have had very credible death threats against me and very serious harassment of myself, my wife, and my 3 children. Constant, not one-offs, but constant on an almost daily basis, so that I have to have armed federal agents with me all the time. That is unprecedented and almost bizarre that a public health official, because only thing I've said is we should get vaccinated, we should wear masks where appropriate, and we should observe good public health practices.
And how do those threats manifest without getting too into the weeds in it? But I mean, do you head on over to fill up the car with gas and somebody comes up to you?
They don't do that now because I'm surrounded by agents. So, but what they do is that they, with the modern technologies, they know your home address, they know your work address, they know your cell phone number, they know your home phone. So they get on and they send very threatening messages. And they know my children's phone numbers and where they work and where they live. And they do the same thing to them. It is unnerving to a young woman, i.e. my daughters, to all of a sudden get everything from sexually explicit to violent, threatening emails and letters and notes and things like that. It's really very bad.
And so do you get to keep these armed guards?
Yes, they will be with me for a while.
I wonder what the moment was when you realized that attitudes had shifted.
It was right in the first few months of the Trump administration when I was put in a position which was very uncomfortable for me. I didn't relish it, where I had to publicly contradict the President of the United States when he was saying things that were just not true and that were misleading. And I just could not stand there and not comment when things were said that certain drugs worked when they didn't work.
I said, yeah, I'd like it. I'd like to take it. A lot of people are taking it. A lot of frontline workers are taking hydroxychloroquine.
Hydroxychloroquine is not effective in the treatment of coronavirus disease or COVID-19.
Or when this would just disappear like magic, when we knew it was going to get worse. Once I started doing that, it engendered in the people who were the devotees of the president that I was the bad guy in the room. And I was all of a sudden become the boogeyman that you should be attacking.
Is there anything that you, in retrospect, think that you need to own around the messaging?
I don't run away from owning anything. I'm not perfect. I have not done everything perfectly. If I were to do something differently, I would have put more effort into trying to explain the uncertainty of the situation and not make it seem that when I say this today, that absolutely that'll never change.
What happened that you didn't see coming?
The multiple waves of variants we never would have imagined by any tabletop exercise that you were going to have a virus that had a major explosion, came down, and then all of a sudden you had Alpha, Beta, Delta, Omicron, and even today we're talking about sublineages of Omicron. We're 3 years into it right now. No one ever would have imagined that that was the case.
I was in high school at the time that you were doing your work on AIDS. People were protesting. Fire Fauci was a phrase that we heard in the 80s. That must have been a very different experience.
It is night and day difference between then and now. I never, ever had any threat of physical harm to me from the AIDS activists. The AIDS activists were correct. And what they were saying was making perfect sense. The well-meaning but somewhat rigid process of doing clinical trials was not well suited for that type of disease. And they wanted input. That's when I did something which is probably the most important thing I've ever done, is I said, let me bring them in as opposed to keeping them out. That's completely different from people who are actually spouting lies that are untrue, that are trying to create conspiracy theories and other things, and who are actually stimulating a far out group in society who actually does want to kill me.
We must live free or we will die!
I think I know enough about you now to know that to use the R word in terms of retirement is a really bad idea, that your eyes would probably roll into the back of your head. 50 years of public service doesn't just stop. You just don't head to a beach.
Right.
But what are you up to?
I'm 81. I said, at my age, what do I have to offer my country and society? And I figured the benefit of my experience in some very tough times of emerging and re-emerging infectious diseases dating back to the beginning of HIV in the early 80s, Ebola, Zika, pandemic flu, the anthrax attacks, and now this historic, unprecedented outbreak of COVID. What I have to offer is perhaps some ability to advise or provide some wisdom to people with less experience.
Dr. Fauci, thank you for everything, not just in the work you've done, but in your accessibility to folks like us up here.
My pleasure. Good to be with you. Thank you very
Take
much
care,
for
sir.
having me. Take
Cheers.
care.